Welcome everybody to the Holistic Vet Sisters. Four of us today. So yeah, lots of opportunities to have your questions answered. And we get to hear more from the other side of the world. So today we're here with Kathy as well, who has got up super early to be with us. Hi, Kathy.
Hello.
Tell us what time it is with you.
It's 3 a.m.
That's dedication.
Yeah, we
Yeah.
so appreciate you. You've been here before, and we really loved you as a guest. So I begged you, and thank you for being here.
Pleasure to be here.
Oh, thank you.
So also here with Dr. Victoria, who some of you know from the Expo. She spoke about TCM at the Expo, which we all loved, and she'll be back again in 2027 as well. Yeah, it's exciting. We're going to be learning more about meridians. Yeah, Lise, do you want to start today?
Do you want to go straight in with a question?
Yeah, or yeah, we find a bit more about how Dr. Victoria and Kathy are, or it's up to you.
Okay. No, we'll swap roles now. I'll insist on
Okay.
questions because we had a question that we thought we'd cover again. We've talked about vaccines many times, but we have a question. I mean, always feel free to get back to us. And if anyone has asked questions that haven't been answered or that they would like for us to go, then maybe there's more information and we could go into more depth, do come back to us because we get questions and sometimes they get carried over and sometimes they could get overlooked. But this is one that we get a lot, but it's still nice to see how it applies in a particular case, I think. Sarah asks, sorry, I know you've talked a lot about vaccines, but I have just had my puppy's first jabs at 14 weeks. Should I wait 4 weeks and titer test or get a second jab in 4 weeks? I have hopefully I think it means been trying to achieve natural immunity, walking him in local quiet places, but worried I may be putting him at risk. At the same time, I want to get him out in the woods and to classes. So there's a lot to say about that. Victoria, do you want to
Well,
do your thing? You've got
my first question before I do my thing, um, what was in that first jab? Because what diseases are we actually talking about? If we decided to do a lepto vaccine at 14 weeks and that was the first vaccine, or at whatever age it was, then you're going to have to do a second vaccine for the leptospirosis, because it does require two vaccines. First one is to stimulate the immune system into action, and then the second one is what will develop so-called immunity. I say so-called because it's lepto, it's a little bit more of a gray zone. But if we're talking about parvovirus, hepatitis or adenovirus, or maladie de Carré in French, which is distemper in English, if you needed to know the French, those are viral diseases that are, if we're immunized against, i.e. our own immune system is responding to it, then we are able to neutralize the virus if we're exposed. And it's a difference between the lepto, which is a bacterial spirochete, and the viruses that we're talking about, or that I think she's talking about when she's asking about titer testing. I've never found a titer test for lepto that is in any way reliable
or needed. I think that's a very common myth.
Yeah.
People always say, well, we can't titer for lepto, but no, we don't need to. There's no need to titer for lepto because we titer to confirm immunity, and we know that lepto doesn't give very long immunity. So why would we want to do that? But anyway, sorry.
The mechanism is not the same, right? So I
Mm.
think it's important to say that. And then, of course, other typical things that are given to puppies is the parainfluenza or the flu. And then sometimes they're getting Bordetella bronchoseptica as well, which is one of the components for kennel cough. So all of those things is the first thing I ask is like, okay, but what diseases are we actually talking about here? Now I'll do my thing. Let me see. This is a first for the holistic vets, I think. So I'm hopefully sharing a screen.
Yeah, we can see it.
I don't know if you can you see my my mouse arrow?
Yeah.
Okay, cool. So This is actually from the WASAVA guidelines, the vaccine guidelines that were published 2 years ago. And this is really the crux of the issue, is the maternal derived antibodies. So when the puppy is born, normally the puppy will receive colostrum from the first feeding from the bitch, from the mother, and that will transfer antibodies, which will then protect the puppy during his initial days, weeks, months. But it depends on what is circulating in the bitch at the time when that colostrum is produced, and then how much of it the puppy is able to get into his system. So we don't know how much of these maternal antibodies the puppy received, and this is where it can get complicated, and it will depend on how many circulating antibodies were in the bitch, and there's a lot of variables to take into account. And so this is where this repeated vaccine protocol has come from, where we talk about giving between 6 and 8 weeks of first vaccine, and then according to WASAVA, it should be every 2 to 4 weeks we give another vaccine up until 16 weeks. And then just in case, because maybe there's still some maternal antibodies hanging around at 16 weeks, then we should give another one at 26 weeks, which would be 6 months. And the problem is this red line, because these are the maternal derived antibodies. So they start up, let's say, quite high, and they might not be that high, depending, as we just said, but they will decrease over time. And it's when we get into this red window here that we're no longer protected by the maternal antibodies, but this red window will prevent the puppy's immune system, or the cat's immune system, or the whatever species we want to talk about's immune system, from responding to the vaccine and what we're trying to immunize against. So we need to get the maternal antibodies low enough for the timing when we give the vaccine, for then the immune system to respond to the vaccine itself and not have the maternal antibodies responding. And so when is the best time to vaccinate? And that's the big question. So in the example, I think it was 14 weeks, right?
Yeah, yeah.
So at 14 weeks, we're somewhere around here. So in the majority of cases, we're probably okay to do one vaccine for the 3 viral diseases, so distemper, hepatitis, and parvovirus. But if that mother, the bitch, had a lot of circulating antibodies and that puppy had a lot of colostrum, there is a small risk that there may still be these circulating maternal antibodies at that stage. So in answer to the question, I would say probably you're okay, but I would titer test. You can do it from 1 week, but sometimes they haven't responded yet. I would do it from 3 or 4 weeks post-vaccine, just to be sure that the puppy is immunized.
And I think Sarah, who asks the question, is probably quite into this already, because she asks, should I wait 4 weeks and titer test, or get a second jab in 4 weeks? And I think the short answer is you can do either. I mean, I think it's a very responsible and very informed, very knowledgeable question, really, you know, because you could argue either way. And I would say that what would decide for me would be the temperament of your puppy. Because if you have I don't know, I can't think of a very fragile papillon, you know, I mean, a very tiny, worried, vulnerable puppy, where you think taking a blood sample is going to be major trauma, then maybe it's easier just to give them a second jab. If you have a dog that's going to lie, you know, a Labrador or whatever, that's going to lie on the table and eat snacks and not care at all, then I think there's no argument against a titer test. But I think it's a question that shows a deep understanding of what you were just explaining, really. But I think you can go either way. The main thing is that you don't vaccinate at 14 weeks and just let that be it. You need to check after, whether you do that at, in this case, 18 weeks, or whether you do it at, I don't know, 6 months. But you should check, because if it's then positive, then, I mean, in my opinion, you can just leave it forever. But if you want to follow the WASAVA recommendations, you should titer test again 3 years later. But it's important to check. It's less important, in my view, whether you have a second one in 4 weeks or whether you titer test. Titer test would be ideal, but there could be good reasons against it, I would say.
I had a question recently actually on my forum where someone was asking about this, because their vet was actually it was a breeder, so she has 7-week-old puppies, and she needs to take them in for the first vaccine at 8 weeks, and she was asking if we could titer test the puppies to determine whether that 8-week vaccine would actually be appropriate or not, because if you still have these circulating antibodies, it just doesn't make sense to vaccinate at that point. And she was having issues because the vet that she contacted that could or would didn't want to traumatize potentially those puppies at 8 weeks by getting blood. And I think what Lisa's saying is really, really important, because if you go into the practice saying, okay, my puppy's 8 weeks, 10 weeks, 12 weeks, 6 months, whatever age, at that young age, you definitely don't want to traumatize them. The risk benefit of traumatizing a young puppy for the next 10 or 15 years or 20 years, if we're really lucky and we do things right, that means that every visit from there on is just going to be traumatic and difficult and probably needs some chemical restraint going on or a lot of time taken to fix it. So is it really worth insisting that I want a titer test in that kind of situation? My personal experience is if you take the time with the puppy and you feed them treats and you listen to them, some puppies, they don't like to be held too much. Others, you really do need to hold them and secure them for anxiety reasons as well. And you need to adapt, and you need to also be able to call it. Like if you see that the puppy is getting stressed, to say, listen, I really think we should stop. And I normally say, if you really want me to insist, then that's your choice, it's your dog. But I feel right now that we should stop because this is turning into something that's too stressful and that's going to have a traumatic effect going forward.
I think that's really important. There's a lot about time and skill. I mean, my colleague who does these at our practice, I haven't done it myself in many, many years, but she's so good at that. You know, they will just eat snacks. She'll just be giving them treats and playing with them and talking to them, and then she's taking blood. And quite regularly we have breeders bring in whole litters and they just try to test all of them. And most of the time, I mean, this will be typically be at like 7.5 weeks when they come in to be microchipped, etc. And they are very, very common, all of them. I mean, the safe bet would be to say that they would be positive. So, I mean, that sort of illustrates that we vaccinate a lot of dogs at that age where the vaccine doesn't do anything. But again, you don't know unless you test.
Except my puppy, which is now no longer a puppy, but when I was discussing with the breeder that we were going to adopt this dog, and I asked them about the vaccine protocol and what their protocol is, and I said, listen, I don't want my puppy getting leptospirosis at 8 weeks. It doesn't make sense because I'm not going to give him the second one at 12. So just don't do it. And can we titer test for the DHP? And of course, no, we can't. So I said, well, okay, if I don't have a choice, then you're going to vaccinate the puppy, but only DHP, nothing else. They don't have just the DHP, so we had DHP PI, which adds the parainfluenza, which I actually prefer the intranasal version than the injectable one. But anyway, that's how it was. I negotiated the lepto by actually phoning the vets myself and saying, I'm a vet, so I kind of got the trump card there, and I think that's difficult for clients and pet parents. I had the vet card, so I could say, like, I know this is really informed consent. I know what I'm doing. And I think it's hard for owners to make that call because then they get talked down from it, I think. And the vet or the breeder will say, no, we have to give the lepto. That's, I think, difficult for people. But anyway, so Ziggy, he received the DHPPI at 8 weeks. And then he came to me just before his 12 weeks, which meant that he could travel into Switzerland without having the rabies vaccine. Luckily, those dates worked out because I think giving rabies vaccine, I understand why we need to do it for travel, but giving it to young puppies, I'm less keen on. I prefer them to be older than 6 months if we can. So that's what I tend to do. So anyway, he arrives the next day, whoop, into the practice. We pulled blood and it went so well. Treats. I mean, poor guy, he didn't really know what was going on. He hadn't even been with me for 24 hours. And so I titer tested him 12 weeks, 16 weeks, 20 weeks, 26 weeks, and several times since then, and he's 3.5 now. Kind of just out of fun, to be honest. His titers have not moved. So I was lucky that 8-week vaccine was the one he needed, and he responded to. So
and I think there's enough dogs that in that situation that it's worth doing one or the other. You know, there's a risk to doing nothing till 14 weeks. I did that with my own dogs as well, but I'm not going to recommend that to the general public because it goes against WSAVA guidelines and there is a risk to it. I mean, if this puppy had caught parvo at 10 weeks, that could have been fatal. But there's lots of different ways to proceed. It's just understanding the risks. I think that's important. Kathy, what would you do in this situation?
Yes. Well, a very topical question, and here in my practice, like people know about titer testing and a lot of interest in it, but I'm very much in your camp, Liza. I think I'm a bit old-fashioned and I like to not give the first vaccine so early. It's a shame a lot of them come, already at 6 weeks having a first vaccination, which I think is a bit early. But I think in many ways, I don't. This is probably going to be a very unpopular answer, but I'm going to give it anyway.
Go on.
I think because a lot of what I do is behavioral medicine, and I think I want to make it positive. So I just think, like, why bother? I just encourage people to just vaccinate them, and then we just start the testing when they're older. And I use when again, I loved your point too, Victoria, about a vaccine just isn't a vaccine, and it takes a lot to unpack this with people. Which vaccine are they talking about? But if we're talking about DHP, which most of these conversations are around, then I use one that's registered for early finish. Yep. That's what I do. So I would give 2 of a registered early finish and then test the following year.
I think that's a very
I like to keep it simple and
too.
practical, and it's all very interesting, the science. I think we've got to wait another 10 or 20 years until we get a magic body scanner, that can actually work that out off a piece of hair or a bit of saliva or a little finger prick or something simple, and then I think we can get a lot more sciencey.
Well, they're actually saying now, BioGal is saying they only need 1 drop. So they are now, I don't know whether they've got, have you seen, because I've seen they've had this kind of marketing thing where they've said, now we can verify that you don't need to go IV, you can just, well, I mean, you do, but you can just do a drop from the ear or something.
I went and looked up the paper. So they use these little capillary tubes that they then filled with saline with like an ear prick, like I do a lot of these ear prick things in cats just to get a drop for FIV, FERV. So it's the same kind of principle. You just go on the ear or in the foot pad, even same thing, anywhere where you can get a drop of blood like you would for testing for glucose, and you put the capillary tube, you fill it, and then you use the sterile saline to fill the rest. And the results of the study were actually that they tended to have the titer test reading slightly lower than what it would from if they took whole blood and titrated from the whole blood. So there's an argument to say, but it may come back as a false negative or falsely low. But the argument in the published paper was at least, well, it's less invasive. It requires less restraint. And in the worst case, it's going to give us a result that is favorable and encourage us to vaccinate rather than miss cases because it's over-interpreting the presence of antibodies. I haven't organized myself to do it like that yet, but maybe I should.
I actually think that's really, really great, because one thing that is often not really put into the mix when you're doing titer testing or any kind of blood testing, really, when you take that amount of blood out from a body, and this would be the case with us or cats, horses, dogs, whatever, yes, the blood can replace itself, and that happens fairly quickly. But if you had nutrients in that blood, you've lost those nutrients. So to get those back in is even more vital then so if you're taking more blood, you're going to lose more nutrients in that time frame. So to take less, I think, is just Brilliant. I mean, absolutely, you should be doing it. Yeah, as soon as you can.
It's an exciting development
Mm.
for sure, but I do think I'm always a less is more person. And what's the most practical and the simplest, that's the least traumatic, I'm always going to go there.
Yeah.
So what vaccines is the vaccine protocol in Australia very similar to the UK, for instance, I wonder? I mean, do you vaccinate against, is it like Victoria just described, lepto, flu, kennel cough, and the DHP, or do you have any others?
No others, and lepto is not commonly given, only in certain areas. It's a newer illness here, but it wouldn't be routine.
That's
Interesting,
Nice.
because you're hotter. So you'd have different strains. Well, certain parts of Australia are, so
well,
you'd have different strains.
but that's what Wasava say, because I think it was the 2016 edition of their vaccine guidelines, they did not consider lepto as a core vaccine.
Mm.
DHP was, rabies was
Mhm.
always dependent on the local environment and the local legislation.
Mhm.
And lepto was not in that list, in the same way that the Bordetella, the kennel cough, and the parvovirus, sorry, not the parvovirus, the parrot influenza, the flu, leishmania, all the other kind of the tick-borne diseases as well that we can vaccinate against. And then in the 24 version, lepto came in as well, it's almost a core vaccine, but not quite.
No, it's a very non-committal thing, and I was gonna, I don't know, poke my finger at you if you said it was a core vaccine, because it's not. But you hear this all the time. Now it's a core vaccine, but they've given this very woolly grey area thing, haven't they? Where they say it's a core vaccine in places where the disease is widespread, and you know that serotypes, and those serotypes are in the vaccine. And when you ask them, okay, where is that the case? They can't, they haven't got an answer. So it's a very kind of non-committal bit of useless advice, if you ask me, really. They're saying we should probably be more careful, but
Yeah.
you know,
Keeping everybody happy, aren't they?
yeah. And they're saying it's a core vaccine, and then everybody stops there instead of including in areas where, and then all these things that I don't think, I mean,
Well,
certainly.
what is difficult for me is that the University of Bern, which is 40 minutes from me, they did a study when in Switzerland it's called the lepto 6, but it's in other countries the lepto 4, which has the cross protection for the two additional. Sorry, no. Now it covers 4 of the leptospirovirs, and there's a cross protection for the other 2. Anyway, and this study at the University of Bern at the vet school showed that they had reduced number of lepto cases since this L6 vaccine or L4 vaccine came out. And who paid for the study?
The drug company for sure.
MSD, Merck,
Yes.
who produced the Novivac. So I really struggle when someone comes in and asks me, like, do we need to consider it core in this area? Because I'm like, well, 40 minutes away from here, they did the study, and the referral area is my area into that university population. And they demonstrated that actually they have fewer cases since the new vaccine came out 10 years ago or so. So it's a little bit frustrating.
That raises a very interesting question of who's supplying the data. Yes, but we could talk for many weeks on that topic. So yes, vested interests and all those things.
Would it be that the bacteria itself has reduced in population due to environmental changes or some other? So it's not there to be caught. That's what I mean.
Well, they identified the serovars that they then started vaccinating against. So yeah, it conveniently looks quite nice. Shouldn't say that like that, but
So while we're talking about vaccines, this is going to be a great episode to refer people to, I think, as well. So can we just mention some of the ways to mitigate the potential effects that the adjuvants could have on the puppy, that are the adjuvants in the vaccines?
I think the main one, I mean, it's a really good point, because there are some really important things when you vaccinate. The main one, in my view, is to try to not lump all the vaccines together. If you have decided, I think in most situations I wouldn't decide that, but if someone wants to give a puppy rabies, leptospirosis, and you know, non-core and core vaccines, do it in as many goes as you can. You know, try to spread them out. It's very well established that there are fewer side effects when you give fewer vaccines in one go. So just give one vaccine, come back 3 weeks or a month later or whatever for the other part. You know, if you don't give rabies until 3 weeks before you travel. Don't give it now, just in case you decide to travel later or because you're at the vets anyway. Lots of vets will have this very, very helpful, now that you're here, why don't we save you some money and give them all? But it's really not a good idea. Spread them out as much as you possibly can.
And you did say it, Lise, but 3 to 4 weeks, 3 weeks minimum, because it takes a minimum of 3 weeks for the immune system to, let's say, recover. So then if we're re-stimulating, and I would prefer to spread out even more, because if we're just
as
doing
much as possible
all the time, then we're accumulating it. And the other thing I would say is I do a lot of titer testing, Kathy, and I use it to determine when we should vaccinate puppies. I do an individualized protocol, so it depends on who it is, how they cope with it, and so on. Now I've totally lost what I was going to say. No, I think giving less vaccines is also a way of managing it, because these adjuvants are in each of the vials. So if we're giving a whole load of vials at the same time, then we're just overloading at time 0. If we're then dividing that, we're still giving the same number of adjuvant, but we're giving the body some time to manage it, which is useful and will definitely help. But if we can limit the number of vaccines that we give by timing them appropriately, typically if I wait until after 16 weeks to give a rabies injection, it's valid for 3 years. If I give it before 16 weeks, it's only valid for 1 year. So I would prefer to wait till 6 months, but if I can't, can we please wait till 16 weeks? That kind of thing.
Yep, agree. And then supporting them just on a, you know, a nice wholesome diet as well.
Get
Absolutely.
the nutrients in.
Yeah.
And I mean, and you have homeopathic remedies as well. I will use Chinese herbal formulas to manage the toxic heat that is generated from the vaccine. And like I said, I prefer for the flu, I prefer the intranasal version than the injectable. When we inject anything, we penetrate directly through the circulating defensive energy that we have on our skin surface. And so we don't give the body any possibility to mount a normal defense against that. In Chinese medicine, we call it wei qi. So by injecting, we just dive straight through that, and then the poor body is like, whoa, we're in a different level. And where did that come from? So the vaccine,
I think that's a super important point, Victoria, as well, for people to appreciate. You know, again, vaccines aren't vaccines. If you inject it, you're putting it like deep into the organism, whereas if you can do intranasal or similar, much better.
and I do the same with things like anti-inflammatories. If generally we'd start with an injectable, I tend to give the oral to the client and say, listen, let's start with the oral, because then I don't have to inject. I just don't like injections. I mean, we need to do them sometimes, but if I have an alternative, then I like it.
Yeah, no, absolutely.
Agree.
And like you said, as a homeopath, I would always recommend that anybody who needs a vaccine has the homeopathic remedy Thuja, Thuja. Doesn't matter whether it's a baby, human baby, or a horse, or a dog, or a cat, or what vaccine it is. It really helps protect the immune system. There's one more point that I just want to add to this question that Sarah asks, because she finishes it off by saying, you know, she's worried about putting him at risk, but at the same time, she wants to get him out in the woods and to classes. And I would say that's almost the most important thing to say in this context. You know, 14-week-old puppies should not be isolated in any shape or form, and 7 or 8-week-old puppies should not be isolated in any shape or form. He should be out there in the woods and at puppy classes. The risk is minimal. It is microscopic compared to the risk of not achieving optimal socialization, which can lead to all sorts of problems that can also be fatal, far more fatal than the risk is much higher of dying of poor behavior, to put it that way, than it is of dying of parvo. So never ever isolate a puppy. And I take that back a little bit. I would never ever isolate an unvaccinated puppy. If there is a time period where you want to be a little bit careful and maybe stay at home and play in the garden, it would be the week following the vaccine. That's when the pup is most vulnerable. But not being vaccinated is not an excuse for not being out and about. That was the advice we gave, I don't know, 30, 40 years ago, but it just shouldn't exist today, in my strong opinion.
What is Kathy's opinion on that as a behaviorist? Because my understanding is there's quite a lot of published literature on different socialization periods. Oh, we've lost that. Different socialization periods and the importance. And if I remember correctly, I think it was between 10 and 12 weeks. It's really a critical time for the puppy, and they really shouldn't be getting any trauma during that window. And so maybe you should even avoid the vets between that window, and maybe go like before 10 weeks or after the 12 weeks, because of the development stages that they go through. But Kathy is definitely more qualified to answer that than I am.
What do you say about puppy exposure, Kathy? What would be your advice to a new puppy parent?
Yeah, I absolutely agree with you again, Lise. Yeah, we've got to, the most important thing is their mental health and their socialization and getting them out. Much more significant than minute percentages of contracting. I mean, the only significant infectious disease that we vaccinate against in Australia for puppies is parvovirus. I think there's far too much obsession with that. And it needs to be much more about the socialization, and yes, trying to get those positive experiences in during that socialization window, and reduce aversives. So agree, ideally not between 10 and 12 weeks to vaccinate, but doesn't matter. I mean, all of us vets who are doing the right things, we're all going to be keeping it positive.
But you agree that getting out there is the most important thing, and not to isolate.
The most important thing.
Yeah.
Absolutely.
I'm pleased.
But seeing as Sarah talks about getting him into the woods, as I said, the day after Ziggy arrived, I pulled the blood, I did the titer test. And then the next day we went into the woods, and I was like, I know my dog is immunized. So I felt pretty happy about it. I didn't know for how long he would be immunized, of course. Was it the maternal antibodies, or was it his? As it turned out later, I knew it was.
Sure.
It was
I mean, at that point, they could have gone negative any day between testing, but sure. Yeah. Kathy, can I ask you, now that you say that your main interest and expertise is in behavior, can I change the topic completely and just ask about dogs that can't be home alone? What secrets can you share? How do you approach that? I mean, that's the biggest one I get, I think. Car sickness and dogs that panic when they're left home alone. You can explain that to us in 2 minutes, how to cure that, surely.
Oh gosh, yeah. Yeah, there you go. Very difficult problem to solve in the short term. And of course, I generally only see them when the problem is chronic. But again, I think with that, the most important thing is for us to be training up our puppies and dogs from a young age to get some experience with that. And I find that that's a massive thing that people can do, is get it's usually a dog problem, get their dogs used to that. There's no quick fix. It's got to take time to implement a protocol of letting the dog used to it, and they need some kind of neurochemical support for their brains to even make it possible.
And how do you do that? I mean, are you talking conventional drugs or
yeah, whatever. Yeah, no, anything, in that homeopathic, herbal, anything in that box of tricks, or, oftentimes with separation distress, I find they have to have what we might call conventional medications, things like Valium, or, things in that category, not necessarily the PAMs, but something pharmaceutical. It depends on the severity of it. But
But
you
you said you
basically
was,
got to make being away not so traumatic.
I
but
think you're right in terms of like sort of how what are they doing when you're away? What are the symptoms? You know, are they
Yeah,
ripping up the sofa?
yeah.
Are they howling? You know, what are the behavioral symptoms as well? Because in Canine Flow, I have really, really helped people with dogs with SA. And the way we look at it is that we're not seeing, we're really, especially up till now, we're very keen on seeing dogs as mind-based beings. But what they're trying to do is emotionally connect with your heart. So if you have a heart wall of any kind, whether that's trauma, whether that's a layer of grief. I've had people whose dogs haven't had SA, and then they've lost someone, they've had a bereavement, and someone close to them, and the dog has got SA because what is happening, in my opinion, is in the majority of cases, when you're with the dog, they cannot get to your heart to ground on you. So they accumulate a charge of emotion that they don't know what to do with. And when you're gone, they don't even have the hope of giving you this emotion and connecting heart to heart with you. So they really go to pieces. But when you are there, you'll be noticing things are changing as well. So they will be chewing more, or they will be whining more, or they will be doing other things to try and ground because you're around, but they can't get to you. And then when you go out of the situation, out of the picture, they really go to pieces. So what I have supported people to do is clear somatically their own grief layer or whatever heart layer is there. The dog can connect with them. Sometimes, you know what it is? Sometimes it's just busyness. It's not even about, oh my goodness, I've had this awful thing happen and I've got this layer, which is quite natural. It's very natural. You call it the Shen, don't you, in TCM? But it's very natural to have these emotional charges. And it's very natural for dogs to connect with those as well. And they're not doing it mentally. They're not thinking, oh, you've gone, so now I've got to go and chew the sofa. But if we're really busy, we almost put up this barrier of I'm such an efficient, busy woman, you know, and I've got to get this done, I've got to get that done. And the dog can't connect to us, it can't get to our energy. And so they don't know what to do with it. And so when we go away, they're left with all this charge of energy. And it has to go somewhere. Sometimes it goes into sound frequency because emotion is a measurable frequency, and they might howl, or sometimes it goes into the destroy because they need to chew and ground from their mouth, the limbic system where the emotions sit. So, I've just found it. For me, that's how I've helped people with SA, which I know is different. And you know, if you do what Kathy's saying and you get them used to it in the first place, 9 times out of 10, you're not even going to have it happen. But like I said, it can happen if you've had something traumatic happen to you, or something deeply emotional happen to you, or perhaps you get a different job and you're otherwise engaged and you can't connect with your dog in the same way. These things can happen. I mean, I had a lady come on my retreat once. I never forget this dog. Oh my goodness. And she literally couldn't go to the loo without the dog going with her. Even on the retreat, it was like goodness. And this dog, as we went through the 5 days of the retreat, it emerged. This dog never played. She wouldn't play. She'd lost her flow. So she wasn't grounding on anything. There was never anything going in her mouth apart from her food. And she wasn't on raw meaty bones and chewing, the classic grounding opportunity, of course. And so we encouraged the dog to play and chew on toys and shake. And what we did is we got the guardian, they hadn't been together that long because she was a rescue dog, to really love the toy. It was like we said to her, you're going to feel really stupid now, but we just want you to love this toy so much, like it's the best toy you've ever had and you can't believe it. It's your best Chrissy present, you know. So like really love it, give all your energy to that toy. And the dog wanted the toy. She'd never wanted toys from her owner before, but when the owner put her heart energy on that toy, the dog wanted the toy. And the dog took the toy, and the dog started to be in the flow. That's why I call it canine flow. And she was grounding. And the behavior started to change when the lady went home. You know, it was gradual, but she could at least go to the loo without the dog being there.
Mm.
But yeah, that's the go on. Go
No,
on.
but you're the boxer.
Well, yeah, do you know though, but breeds that have the wider mouths, they do find grounding harder. I mean, they've got more emotion, more space for emotions, haven't they, as well? So,
And I would add to that that emotions are definitely, well, definitely scientifically, it's difficult to prove that. There are examples such, well, in humans, they did a big study in Scandinavia somewhere where they looked at post-traumatic stress disorder, and they found that there was a really significant increase, maybe 5 or 10 times increase of people having chronic GI problems, Crohn's or IBD or those kind of issues. And that's something that I see as well. And I associate a lot of emotional things with having gastrointestinal problems. And from a Chinese medicine perspective, it makes sense. You can easily explain it. But I see this so much
yeah.
that that's how it's kind of expressed. And I'm on vacation, by the way, but I had a discussion with someone today, a client, um, and she has Shih Tzus, and she said to me, "Yeah, but no, Chinese herbal medicine, my dog doesn't like it. It doesn't work. He vomits it. It doesn't go down well." And I was like, "Well, we gave one formula. We used it from a Western perspective, actually, because I used it because this dog had Clostridium difficile." Um, and the dog didn't get on with it. I'm like, but that formula was really cold and it's really hard to digest. So I'm not surprised that that dog reacted that way. But that doesn't mean if I give a tonifying formula or another formula that's maybe going to its heart and its shen, that it's going to be the same thing. And I said to her, because she's often saying to me like, oh, but this doesn't work, or for Shih Tzus that doesn't work, or she's sort of blocked. And I tried to say to her, listen, if you come, because I told her, convinced her to come for Chinese medicine with this dog. I said, if you come for Chinese medicine and we do acupuncture and I prescribe Chinese herbals, and you're not convinced about what we're doing, that you are blocked thinking this isn't going to work, my dog is going to react badly, then I might fix something or move something or have an effect with my needles, but it's going to be gone by the time you get home probably, because your energy and your attitude to this treatment is totally like there's this wall against it, and we're not going to advance. And then you're going to come back and you're going to say it didn't work, Victoria, or he got worse, or this and that happened. And I really tried to say to her, listen, if we're going to do this, I really would like you to be implicated in it and not just, meh, let's try, let's see, but I don't really believe it's going to work. Yes, I can get results when people believe it's not going to work. But if we really want this to work, I need that person to be committed emotionally and intellectually to what I'm doing. Not just because I've told her from an intellectual perspective we can do this and that with the dog, but emotionally she's convinced that we can move forward together and make this work. And I see it so often. I had a case a while ago where I treated the cat for chronic gastroenteropathy, so IBD type symptoms. And when I treated the cat with acupuncture, and when the owner came back a week later, how's the cat doing? Oh, the cat's perfect now. But Victoria, during the treatment, my own intestines started again. She had previously been treated for the same symptoms that her cat had. And I fixed the cat. I moved the energy. I moved the pathological soul back into her.
No way.
Yeah. And it happens quite a lot. It's difficult to explain it, but that was such a real case that during the placement of the needle, she was like, and I remember she ran to the bathroom. Well, she went to the bathroom, but then I was like, oh, whoops.
They take on so much. They really do. I mean, in terms of homeopathy and the modalities that you do, Kathy, do you think the guardian's believing in what you're doing? You know, have you seen that happening there as well? Like, does it matter too much?
Yeah, good question. I mean, sure, the person's attitude and beliefs and energy, like you were saying, Victoria. Yeah, I think it matters. I did just want to say I see a lot of gut issues, yes, related to mental health, definitely there's that same link. And then I agree with you, Caroline. Dogs are very energetic beings, and a lot of the issues, getting back to the separation distress question, is really about letting a dog be a dog, to to do dog things like chewing and sniffing, and as well, they are the person's got to be open and grounded, and they're really driving off the person's emotions. And I think that's one of the really important functions of letting the dog practice being alone, is like, holy shit, just give them a break from yourself, for goodness sake.
Yeah, like
A lot,
who's got the SA, really?
right,
Is it the guardian or the dog?
exactly.
Yeah.
So I think it's part of that healthy self-regulation that they need, is just some time alone and to be allowed to be a dog.
Yeah,
Yeah.
this is the thing. And I think that actually takes us back to what we were talking about with puppies as well, and them getting that early socialization, because
Yeah.
historically we have kind of stopped them biting, and we've almost been
Yes.
told to do that. And whilst, yes, we want them to learn not to necessarily bite us, but we need to actually be redirecting that and allowing them to ground
Yeah.
emotionally as much as possible, like just 10x your enrichment, rather than stopping them from chewing things and making
Yeah.
that something that they feel they shouldn't be doing, or is in some way bringing on a negative association, because they need to be grounding so much. I mean, and
Yeah.
this is where the raw meaty bones comes into it. If you can, this is their natural, more than just an instinct, it's an emotional need to be
Yes.
stripping and chewing, and that's really what grounds them emotionally.
Yeah. Absolutely agree. I'm always recommending chewing and bones as a way to improve dogs' mental health, and cats too. I see with my own cat, she loves to rip into everything, and that's the problem with all these sort of soft cat foods as well. They're not getting that
Yeah,
satisfaction of just chewing and ripping, which is such a vital thing to do.
they're not being allowed to be being a cat in that way. Yeah. So,
Yeah, I think
especially
it's
especially if they
huge.
haven't got outdoor access. I
well,
think a lot of I mean, if the cat is free to go in and out, they make up for a lot of the stuff that we don't give them, both in terms of nutrition and what you were just talking about.
activity,
But
natural
yeah,
activity.
yeah,
Yeah.
yeah, yeah. But if it's indoor cats, then that becomes much more difficult.
Did we have
Cats,
a
Yes.
question
cats
about
really
teeth
suffer.
We
again?
do have a question about teeth.
No,
Did
we
Oh,
you
well,
do.
that's a
Read it.
nice
try and fit that in
segue,
the
isn't it?
last 10 minutes?
I was
Yeah.
I
Yeah.
was just thinking about cats and feeding and stress and environment and feline chronic gingivitis, which is actually quite prevalent even in feral cats.
Welcome
And
to Victoria's trail of thought.
There you go. So we're in an energetic mind meld here. We're very nicely segueing into the next topic.
Let's do the tooth question. Mary says it's a slightly long question, but it's a good one. Mary says, I'm absolutely gutted. I adopted a 5-year-old Maltese Terrier just over 5 years ago. When I got her, she had a cherry eye, which the vet removed, and at the same time cleaned her teeth, which he said were fine. Since then, I have changed vets, and last year she had 8 removed. Back to the vets last week, and she had 12 removed, and has to go back to have the rest out, as the infection has now infected her jawbone. In 60 years of owning dogs, none of them have had dental problems. She is raw fed and chemical free, had chicken wings, etc. I even make my own treats, dehydrate hearts, etc. She's currently on paracetamol, Onsior, and antibiotics, and after 4 days is progressing well. She has to go back to have the rest out in a couple of months. Going forward, what should I expect? And is there something I should be doing to enhance her quality of life? I should add that I was feeding her on Honey's Raw, which she was quite happy about, but the vet said they would rather she had cooked meat because of bacterial infections, the bacterial infection, I suppose, which made me smile. So at present, she's having cooked mince. I aim to please. Okay. Who wants to go first on this one? I mean, so if taking the word
Me,
straight away. It's
I've got a clock.
the dog is 10 years old, and we
Yeah,
don't know, and I don't know if Mary knows what the situation was for the first of those 5 years. So it's a rescue dog.
yeah.
Um, who is 10 years old, which is a high age for any dog. And many of those small little white dogs, so it doesn't have to be white, but I think of them as all as little white dogs. Many of those small dogs have dental problems. Just anatomically, they haven't got space in their mouths for their teeth, you know, and they do tend to have dental problems. So my first point would be to tell Mary, don't be hard on yourself. You know, this may have been absolutely just unavoidable. I
Well, the
don't think
dog
you've
is
done anything
eating,
wrong.
she's eating great raw food, honeys. I mean, that's the, you know, it's really clean meats. So now Nick Thompson shared a while ago, and I think it was in a WhatsApp group. I mean, I'm going to find it. And it was a dentist, a holistic dentist, that was writing about the tooths, all creatures' teeth, self-cleaning mechanisms. And the upshot of it was that we don't get told about these self-cleaning mechanisms. We don't get told how to support them. And they really, really need vitamin K2. And why I thought that was related is because she mentions the jaw, doesn't she? I'm pretty sure. And does she mention the jaw in that question?
No, I mean, and that's the issue. I
And
mean,
what
we can talk about
he
team,
was
but
saying, well, he was saying that if the vitamin K2 isn't present and the self-cleaning mechanism can't happen, that it starts to weaken the jaw. And so it could be that, and that's related to the periodontal bacteria as well. So it could be that this pattern has just formed in the dog's younger life and is still happening. Now, for us humans, it's quite easy for us to go off and get K2. It was, I forget the exact name of it, but there's a Japanese type of fermented soya bean. Does anybody remember this? It's something like natto, might be
Yeah,
natto.
natto.
Now
Yeah.
that has the appropriate kind of K2. So of course I'd gone off and ordered this organic natto as soon as I'd read this because it was so fascinating, this article. I'll have to find it and put it up on our page. It wasn't by Nick. He had found it and was suggesting that we read it. But it's so interesting. So we really need to be eating this K2. You're going to want to eat it once you've read the article for sure. It's not the same as the K2 that's in the large intestine. It's a different version of vitamin K. But yeah, I mean, it could be that this is what needs to be introduced for this dog. That's what I'm sort of getting to. But I'd need to know more about it. You can't obviously just say you must supplement without understanding more.
I think it's probably a multifactorial thing because, as Lee says, but Maltese and these small white dogs or small dogs generally, and I'm talking generally, they are genetically predisposed to dental disease because of having so many teeth, because of the anatomy, because of the structure. And you could do everything perfectly and still be confronted with that. We don't know what this dog ate for the first 5 years of life. We don't know what conditions, what stress, what other environmental factors were involved. And I think that will also have an impact. And I think that generational effect as well, that we just don't know. I mean, there's what was the guy's name now that did the study in the cats? It was a human doctor in the US, and he over several generations he split his cats up. One group got fresh fed and one group continued with processed food, and within 3 or 4 generations he fixed the dental problems that his cats were getting, but only in the group that got fresh fed. Pottinger, I think his name was.
Yeah, it was. Yeah.
And is that involved? I mean, and if that's, I think there's a lot of transgenerational stuff and environmental elements that we can't identify, and we can't always find the answer to everything because the dog isn't going to tell us everything that's gone on in a previous life.
Sure. So this is going to happen sometimes, even though you feed a really good diet. But I think the important issue now is the jawbone infection, which you know is and I think it's really nice to hear that this is actually being treated, you know, in a responsible way. This dog is on antibiotics and painkillers. Anything else would be completely irresponsible.
Yeah, this isn't a homeopathy or Chinese medicine case. We could support them with those medicines, but this is a case that needs Western traditional medicine.
Absolutely.
And I would highlight as well that, I'm assuming that it's the case because if they've identified these teeth that now still need to be removed and that the jaw is infected, you definitely need to be getting dental radiographs if you're having a dental done. So if your vet is not, if you're putting your dog under to do a descale and polish, they should be getting dental x-rays as well, because what we see on the surface of the tooth and the part that's outside of the gum line is just the tip of the iceberg. If we want to really check for dental pathology, and if they're being put under anesthesia, they really need to get dental x-rays as well.
I just assumed, but it's a good point to make, that hopefully this dog is with a vet who is a specialist in dentistry. I mean, that would certainly be my recommendation, and x-rays are given, absolutely.
Kathy, were you
Can
going
I
to?
just,
Yeah.
yeah, I just wanted to chime in and say something on that. I agree with everything that everyone else has said. And really important, yeah, not to beat herself up too much, because as you've all alluded to, there's a lot going on. You can only do what you can do, but it's a really good opportunity to reinforce to our audience that it's not just what you feed, but it's the form of the food. So when we're on a proper raw diet, it has to include those chewing mechanisms to really rip and shear. And I'm sorry, but if this dog has no teeth or a sore mouth, then mince meat maybe, but you really even want to be getting onto chunks, even that the dog can gum it with the remaining gums, and if there's any teeth left, rather than mince meat. I mean, we've got to rip and shear and chew, so the form of the diet's super important.
It would be great to support you, Mary, if you want to just go onto the APNC and find somebody to help you with just making sure that what you're feeding now is giving the dog everything they need. And also not forgetting the mineralization that comes from having decent structured water. I can't stress that enough. I've been reading the water codes the last few days. I've moved from Veda Austin onto another water guru. And oh my goodness, absolutely phenomenal. I'm just, everything I read in this book, I'm just like, water is so, just because it looks the same in all states, it's like diamond and carbon are the same molecules, but they're in different states. They're different structures, but they're actually the same molecules. And they look different, so we see them as different. But when you have structured water and what they call bulk water, which is very unstructured and has become unstructured, it's actually a different substance. It's not in the same structure at all. It might still look runny and clear, but it's actually not the same structure at all. And it's just amazing the difference that these structured waters can have. And things like bone density are some of the differences that it would support,
Yeah,
And
yeah,
I
agree. Water is just another whole fascinating topic, and the energetic properties of water and how we can influence water for positive health.
Water wants to be loved. It doesn't want to be programmed. It's about loving it, according to this book, which it makes so much sense. Yes, we can sort of we can sort of put things into water if we like. We might be able to say, please help my bone density or something like that. And it's kind of happy to do that. But it's like what they're saying is it just, if you love it, it structures itself. And that restructuring will make the difference to whatever's happening in the body, in the same way, in a sense, that homeopathy must do.
Yeah, and that's how homeopathy is made. You put things into water, and the water organizes itself depending on what you put into it through the whole process of, I mean, that's literally how you make the homeopathic remedies. So it's, yeah,
Yeah,
absolutely.
that's exactly right. You put the energetic imprint into the water, and the stuff that you're saying, Caroline, that goes back to some of those very famous water crystal studies
Oh,
by
it
Dr.
does.
Emoto. Yeah,
Oh, yeah. Veda Austin, your New
fascinating.
Zealand lady. She's my other
Mm.
faith. Yeah, it's so amazing how these things come back round in your life as well, because they've been talking a lot about baptism and the original baptism and what it really meant to be baptized, not kind of what they do now.
Mm.
And yeah, really interesting, because of course his name is St. John, and this is the name of the venue for the for the Natural Dog Expo. I mean, it's like, talk about full circle. I was like, wow,
Mm.
okay.
And on a because we got 1 minute left, bringing us right down on a much more simple level. I just want to say two things. One of them is, it sounds horrible having all the teeth out, but actually both dogs and cats, in my experience, without any teeth at all, do really, really well. and they chew and they gnaw and they, they eat things so that nobody will believe that surely they have teeth, and they don't. So it's your dog is going to be fine, even if all the teeth have to go. And I just want to mention also that I hope you're giving arnica. And if you're not giving arnica, get hold of some arnica. Homeopathic arnica, absolutely. I mean, it's a world of different in terms of recovery from procedures like this.
And every 2 hours, you've said before. Haven't you?
Or every 2 minutes. I mean, as
About
much as you
every
can possibly do as without,
Got
you
time
can't.
for that?
No, but I mean, the only argument, I mean, if it's for a person, like I've just had a whole tooth issue done, and if it's a person going to the dentist or having something painful done, I just have a arnica in my mouth the whole time. I mean, after acute injury, you take arnica whenever you feel sorry for yourself, and typically if you have a fractured leg or had a tooth pulled or something, you'll be you'll just be taking it the whole time. And then as it settles and it heals, you'll start taking it less frequently because you'll begin to forget. And that's exactly what you want to do, mirror the energy of the injury that we're treating. So immediately after something like that, give it all the time, put it in the water, give it whenever you can. The only reason against giving it every 2 minutes is that it's probably going to stress out your dog, but give it as often as you can without waking up a sleeping animal or anything like that. But you can't overdo it. It's absolutely needed. And this is a very typical arnica situation. And we are, go on.
Everything this evening is coming back to love.
Yeah.
Love your water, share your love, don't have hatred, and then everything just flows better.
Yeah.
Yes, it does. Can I make a heart? Love you, Victoria.
And thank you so much for being here, Kathy and Victoria. We love you both, and we appreciate you being here, and we want you to come back. Kathy, I'll be embarrassed to ask you to come back at 3 a.m. again, but let me know when you're ready. I think in a few months the time difference is going to be less.
Yes, in a few months it's not till 5 a.m. when
there you are.
it's
It's
us who
virtually
are on
lying.
daylight saving. So that's not quite so brutal as the middle of the night in winter. So absolute pleasure. Thanks. It's always really stimulating to come together with other vets and kick the can down the road a bit. It's it helps to fill up our collective cups. So thank you all very much.
Thank you very much for joining us. Thank you, everybody.
Thank you. Bye.
Bye.